Hi, everybody, and welcome to this edition of the Vaccine Team podcast. I'm Kara Sundlun, and I'm delighted to be joined by Dr. James Cardon, and he is the Chief Clinical Integration Officer with Hartford Healthcare. But what it means for everyone listening is you're really the guy who's in charge, I'm sure with a couple other people, but of getting shots into arms and figuring out those logistics and trying to get people vaccinated as soon as possible, right?
Correct, and it's an enormous team, not just a few people. We've dedicated a large group of people who are working headstrong into this.
And an enormous task. And we're hearing frustration from folks. We're doing really well. Connecticut's getting a lot of great marks in how we're testing and even how we're making sure we don't waste vaccines. But on our Facebook pages and calls in the newsroom, people are really calling frustrated that they're getting on, they're trying to make appointments, they're trying to use that VAM system, and they're just being told there are no appointments or they get logged off. And this has really started to escalate ever since the governor allowed 65 and up. What do you say to those frustrated people? Is this temporary, or how do we fix this?
Yeah, it's there's an appropriate, incredible pent-up demand, and for very good reasons. And yet, at the same time, we know we have a limited amount of supply for the people we have. So this process of trying to ensure that we're able to match up supply and demand, and that the fact that this requires scheduling to actually do it safely means that at times you have to be patient. Our goal is to get everybody vaccinated who wants a vaccine. And as we continue to get more vaccine, we will work through these various populations. But there's always a desire to try and get to the front of that line, and everybody can't be there, right? So that's sort of the process.
And so far, you said we've administered about 90,000 vaccines. But my understanding is this next queue that I was talking to Josh Jabal just yesterday. He said, when we said 65 and up, we just added 350,000 people to the queue.
Correct.
So that's a lot of vaccines. That's almost 4 times as many as we've given.
Correct. And right now, we've built capacity to actually administer more vaccines than we have. Right now, we have the capacity to, in our existing centers, we have the ability to do 5,000 a day with our current staffing, and are prepared to do much more than that, including opening up additional sites, which we've secured for when we have the vaccine to be able to do what we call mass vaccination sites across the entire state. So our ability to get this vaccine out is right now limited by the amount of vaccine the state gets. They've done a great job of turning that around and distributing as best they can, and to various providers that are working down this path.
And we know everyone's working hard at this, and we know that nobody had a playbook for this. But what do you think are the biggest challenges? If you could snap your fingers and help get more shots into arms, which is the mission, what do we need to do in the next week or two?
First and foremost is get more vaccine. As stated, we and other providers are all have much more capacity to administer than not. So, and the infrastructure is there. It's not necessarily very complicated to take what we need to do and expand it. We've built out schedules for us. We use the Epic My Chart as our functionality. It allows us to both schedule and really track first, second dose, make sure we don't miss anybody, and that everybody gets the exact same vaccine they got. Dose 1 and dose 2, very important. So it's really just expanding that as soon as we get vaccine in, where you have the sites and the people to do it.
So when you go online, and we did this yesterday, trying to walk through people, and you get there, and some people are like creating a Walgreens app and creating a Walgreens account, and they get there, and then just as soon as they create it, they think they have an appointment, and then it just boots them out.
Yeah.
Is that just because they don't have enough vaccines and they're only creating enough appointments for shots?
Correct. The way this, because as opposed to queue up and you'll get a vaccine kind of process, the nature of this really requires you to have an appointment, and that allows us to, one, make sure we're not overcrowding the facilities. Everybody's coming through in a very organized manner. Two, we have to give the vaccine, but then we also have to observe you for 15 minutes afterwards to make sure you had no adverse reactions. So we need to control that flow very carefully. The last thing, which is we've managed it very carefully, is we don't want to promise a vaccine and not be able to administer it. That's emotionally crushing. And so we want to make sure that anybody who's got an appointment will get a vaccine. And so far, we've been able to manage that pretty well. We haven't had to cancel any appointments at all. We do that by, the elasticity we have in the schedule. When we know we have more vaccines, we open up some additional sites. So even if you go at one point and not find any, you may find if you check back a little bit later, some slots have opened up because it is not a set schedule that's done for the next 3 to 4 weeks, which is about as far as we can go out with any kind of predictability in terms of what we're going to get for vaccines. But we do open up additional sites as necessary when we have additional vaccine to administer.
What about these mass vaccination sites? Will it be easier to get a shot there?
It will be, and certainly it will be. The process will be identical. It's just going to be larger. So whereas we can have 5, 6, 7 vaccination stations in our current sites, we can do 10, 15, 20 at some of the large footprint sites that we can be at. So we can just move that many more people through the center when we have more space. And that's really, we pivot to that as soon as we have enough vaccine to do that. And we'll be doing that over the next couple of weeks to be prepared.
All right. So talk about the mass vaccination sites. I'm thinking of even someone here I know at work who's been trying to get her 2 elderly parents who have health conditions signed up. And she, just even though we're doing all these stories and we know what to do, she keeps having trouble getting an appointment. And maybe it's by area. Maybe there are more in the Hartford area and not as many in the Bristol area. Where are these mass vaccination sites going to be, or where's the best place you can go to get a shot right now?
Yeah, so for Hartford Healthcare, there's 2 ways that I'll give folks a way to find it. One, if you go to hartfordhealthcare.org/vaccine, you'll come to our landing page. That has a tremendous amount of content to be able to both explain the vaccine, educate, to make sure we do still have barriers of people who are reluctant to get vaccinated. So you can learn a lot.
Okay.
To try and really get there. And it's important to get through that as a first part, because trust is the beginning of this. Second is whether you have a MyChartPlus account, that's part of Epic, or not. There's a way for you to go in and register and move through the process to find yourself to be able to schedule a vaccine. It'll walk you through that. If you're not eligible yet, but you'd like to leave us your name and some information, we then keep that and we'll reach out when you are eligible, by age or otherwise, to let you know that it's time for you to schedule a vaccine. So we're now registering people to be able to contact them when they become ineligible.
Okay, so like, for instance, I have a MyChart account because I've gone to Hartford Healthcare before. I actually experimented with going in and it didn't let me make an appointment. I thought it was because it knew how young I was.
Exactly right.
Does that mean it now knows when to tell me to come? Or
we do know, yes, because you have a MyChart account, we actually already know who you are, and that's the way to do it.
And that means I'm going to get an email saying go register now, or will the process
generally
be easier?
It's 2 ways. One, most people are already waiting for when their age is ready, so we don't have to prompt them. But we have done exactly that. We have to 75-year-olds that we didn't hear from. We reached out and said, "Hey, you're eligible. What do we need to do? How can we help you get a vaccine?" So we've been able to proactively, for those that have a MyChart account. You can also leave your name and information, though, even if you don't have anything to do with Hartford Healthcare or Epic, to say, "Hey, I'd like to raise my hand when I'm eligible. Can you reach out to me?" And we capture that information as well. So that is right on that landing page, even without a MyChart account.
The other question I keep getting on my Facebook page is, what about the teachers? When can the teachers be vaccinated?
So it's an important question. And right now we are following state and CDC guidelines in terms of when that is. So we have partnered very closely with the state to make sure that we are administering to the appropriate eligible folks. When they gave us guidelines to go ahead and start vaccinating teachers, we'll open that eligibility. As you already recognized, to get through the logic to get yourself, you need to hit the criteria that may keep it eligible, because we really don't want to disrupt those that are most at risk, which is the state's trying to do, to really put in front who's the people most likely to die or get really seriously ill is this first group.
Yes. And so teachers are still in that 1B group, right? There's a lot of people in 1B before.
There's a lot of people in 1B.
Would they be next, or is there, I know it's underlying conditions next, but are like teachers grouped with first responders, or Kind of how, what's the pecking
They're
order?
not, no, they're not. First responders were really in with the healthcare and group
Okay.
getting exposed. Teachers right now, we'll wait for the guidance. You're right. 1B is a big group. The state has said 1B, but it's really only 65 and above kind of time frame. So we're parsing out the 1B and really creating subcategories around that. So we'll wait for the state guidance. We're ready. And again, to open it up but not have any vaccine to give is it's going to be marrying up. How did we get through this next group or make a significant impact on that group that the state looks at and said, okay, it's time to open up again to the next level.
So tell us a little bit more just about these mass vaccination sites. Like how many are we going to have and exactly where they will be? And
Sure.
do you see that that's going to really alleviate these problems with people not being able to get appointments? I mean, I know we need more vaccine. But...
Yeah, exactly. It'll do both. What we're going to constantly try and do is meet the supply and the demand. That's really what we're trying to do. And what we don't want to be is we don't want to be the rate limiting step. So as much as we get vaccine, we should be able to administer that. So we'll have them in all of the across the state. Down in the Fairfield County, Bridgeport area, we'll be at the Sacred Heart University. And we'll be at Central High in Bridgeport, really to get to those two communities. In Torrington, we're in the Armory out there. That's already one opened up to go. Hartford, we have the convention center. That can be expanded further. And we've secured agreement with the Xfinity Center to use that as we move forward. In what we call our central region, we have both the Oakdale and Wallingford where we'll have a site. And we are just opening up next week, Liberty Square in New Britain in a site there again in the downtown of New Britain to open up access and make it easy for folks to get to. In the out in the East region, we have our Norwich site that has been opened. That'll be expanded at Stott Avenue. And then we're working with Foxwoods to have a very nice large footprint for us to do vaccinations at the Foxwoods. They've been great partners with us.
Is that in the next couple of weeks, or is that the
again as need be, we'll be transitioning. So if you think about it, if we can do what we don't want to do is have a great big site and open it for 2 hours. That doesn't get us what we need to do. So what we really want to do is it's all going to be contingent as what's the projection for vaccines coming in. How do we get it? Can we meet the current demand at our current sites, or do we need to have more room to be able to do these? So that planning is all somewhat as we look at the what we think we're getting from vaccine for the state. We're in close contact with them as they say, this is what we think you're going to have for the next week or the next 2 weeks.
And is that number going up a lot? We heard that the Biden administration just authorized a contract to double both the Moderna and the Pfizer vaccines. Yeah. And I hear Governor Lamont saying that we can vaccinate 10 times more people. I hear you saying we can vaccinate way more people if we had the shots. So when will we have more shots?
If I had that, I'd have all the answers, and you'd all know it because I wouldn't hide it. Okay. I don't know. We certainly are seeing an increase, so it is increasing, no question. This is not just trickling in. I think everybody recognizes that the faster the better. But how fast we're going to be able to get it from the federal governments and these others to come on board is going to be unknown. We do have Johnson & Johnson, yet a third brand that will be looking to be approved for emergency use in the next, towards the end of February, so next couple of weeks.
And that would be just one shot, am I correct?
That is correct.
So that could really help as far as some people are even saying they're having trouble getting back to the second shots. Or I know that the state says that your organization should book you for the second shot when they book you for the first one, but it seems from what we're hearing from viewers that hasn't always worked out the right way.
We've been pretty prescriptive about that. We do give you your second dose when you get your first, and when you're coming back. People can always change, so it's not hard and fast. But every first dose is tied automatically to a second dose in either 3 or 4 weeks later, depending on the brand.
At Hartford Healthcare.
Yes, and Johnson & Johnson, you're absolutely right. It's one dose right now, and that does simplify. It also simplifies logistics. In terms of it doesn't require the refrigeration that some of the other doses do. This will allow us to really move not only these large sites where people can come, but our commitment is to really not just for those that can navigate technology or knows how to get to or has the means to get to one of these mass vaccination sites or any of our sites, but to start really getting into the communities and meet them where they are. not waiting for people to necessarily raise their hand, but go out and help them to get
Yeah.
to where they need to go. And Johnson & Johnson is one of the, simplifies some of that process. We're already working on helping get into the communities, meet them where they are, so that we can vaccinate those that are somewhat most vulnerable and most at risk for serious illness.
And that is a struggle to get, especially I know we've had a lot of questions from minority communities. Are they going to be able to get the shots into certain areas, and even get people on board with taking them? I know that's the next phase, is really getting shots to people who maybe aren't coming out. I want to just let our listeners know we're talking to you, because it changes every day. We're talking to you on February 12th, in case someone's listening on a different day. But you do see that more and more shots are coming. And so you expect this, is this like a bottleneck where, what would your advice be if your sister was going on and saying, I can't get a shot, I can't get a shot? Should you wait a few days? Should you wait a week?
I would check back periodically, whether it's a few days. At least for Hartford Healthcare, we know that we are somewhat. It can be somewhat flexible in terms of opening up additional, because each week we get updated. So that's one. We are cautious in our scheduling. We build it off of what we're confident we're going to have in, but then we expand as soon as we get notified if we have more than we thought. So some patients, I recognize the frustration of not being able to get in as soon as I'm approved, but we will get to everybody. Two, continue to do everything you can to keep yourself and your colleagues and your family and your loved ones safe. Wear a mask, wash your hands, don't get in congregant situations at the moment. We're so close to getting through this. We literally could find ourselves in very good shape by late summer, early fall. So we know mask wearing works. We know the tool works to keep people from getting sick and infected. We just got to stay diligent with that until we get a chance to get everybody vaccinated. So that's always my plea. Everybody's tired and says that we're so close. Now's not the time to give up. We're right there near the end line.
And I don't know if this is accurate, but there were some reports the governor was talking about even easing some restrictions come end of March. I don't know if that's based on how many more people will have vaccinated by then, but people do ask that question. When can we get back to some semblance of normal? That's a crystal ball question, but you would know better than me. So what's your prediction?
Yeah, I think by the time we get to end of summer, I think that we'll be in much better shape. There's still a lot of unknowns, which gives everybody pause. A lot of emerging science around the variants, a lot of, how does the adoption rate do? What is the resistance to getting vaccine? We need to understand that more. But we do know that we can get closer to normal when by doing by vaccinating more and more people, we're making more and more impact. And we see that right now, the evidence, our skilled nursing facilities, we're not seeing COVID-19 anymore yet. That was a clear, very vulnerable population because they're all been vaccinated. So we know that even as we get I don't think we get to herd immunity by spring or early summer, but we certainly can have an impact in combination with your mask wearing. We're going to be in good shape. I give you one statistic, which is important. As you know, flu vaccine is not as effective as the COVID vaccine, and we know that usually the adoption rates are under 50%. Yet with the mask wearing and the other activities we have seen virtually very, very few cases in Hartford Healthcare this year. We're talking about single digits. We'd usually have thousands of people hospitalized with flu right now. We have seen one case, I think 2 cases as of last week. So a less effective vaccine with appropriate mask wearing has really eliminated flu from our environment, which is just a telling sort of statistic for us to keep in mind, is how quickly this can really come under control when we have a more effective vaccine and better adoption rates. So I'm very optimistic, but we didn't eliminate flu with the vaccine. We eliminated flu with vaccine and these other measures that we just got to continue to be diligent around right now.
Yes. So I want to just take a moment to let people know that from interviewing officials like yourself, we can, if you're wondering, how do I get this vaccine? And you're just going, how do I do this? There is a website, ct.gov/Cardon, COVID vaccine. And there's also a phone number that the state is giving out that they want people to know that they can just call 1-877-918-2224. Some people would rather just talk to a human being. I understand that they're answering phone calls 7 days a week, 8 to 8, but you may have to have someone call you back. And that may take a few days because it seems that, as you said, this pent up demand of 65 and up really just is taxing the system at this moment. You don't expect that to stay that way.
No. And we also, if you go to the Hartford Healthcare website, there's also a phone number there. We will, for those that cannot navigate the technology so much, you can call into our access center. We'll also take that call and get you scheduled for a vaccine.
Okay.
So the number is right there on the website as people go.
So this is a question that once you get your vaccine, I'm lucky my mom was living in a congregate living facility in the state, so she got her second dose. And I've told her, because I've learned from doctors like you, she's not fully immune until 2 weeks after that second dose. Right. And then she wonders, well, when I come over to your house, then what do I get to do? Do we all hug grandma and that's fine now because she's vaccinated?
So, the efficacy of this vaccine, either brand that she got, is extremely potent at eliminating serious illness and even moderate illness. So it doesn't mean she can't get the virus, but it really turns it into a much more benign disease at the moment. It also seems to have an impact, although how much, on the transmissibility, her ability to transmit it to others. But that may be still possible. You may still be able to carry and shed the vaccine if you're a vaccinated person. So she could be a vector still to you guys. So what I always say is certainly everybody can feel much more comfortable, but I'm still always aware of at the moment as the science emerges and otherwise, until everybody's vaccinated, it's harder to really say you can completely let your guard down. And I wouldn't do that, especially with your grandma. She can come, she can visit, and certainly feel more comfortable doing that. But I'd still say be very cautious. Anybody who's got symptoms, that sort of thing, you got to be careful with.
Okay, good advice. I mean, but if we're all healthy, I'm already a COVID survivor, so I think I'm immune for a little bit. If we're all healthy, do you take your masks off and kind of relate normally?
I think if she's fully vaccinated, fully immune, and you've got other people that are similar, I don't think there's any need to, if everybody's feeling well, vaccinated or post-COVID and fully recovered, I think that you're fine to do that.
Okay. Well, thank you, doctor, for being with us. And I know that it's hard for people to hear right now that they just have to pack their patience. But I guess we'll hope to get some more and more vaccines as the days go on, and we will continue to stay in touch with you to get people the information they need.
Terrific. Thank you. Thanks for everything you do and getting the information out. It's important.
Dr. Cardon, thanks so much for being with us on the vaccine team.
You're welcome. You good?